Good afternoon, everybody, and thank you for tuning in to our faculty and staff town hall. Before we get into plans and information for this summer and fall, I want to start by expressing my gratitude for your incredible work over the last year. As we slowly start to return to normal operations, I've been taking some time to reflect on my thoughts at the start of the pandemic a year ago. And I distinctly remember the high degree of confidence that I had in our ability to continue to offer a first-class education for our students. The truth is, nobody could anticipate fully what was coming and couldn't even begin to imagine the challenges that we would face as an institution or as a society. But I did know one thing. We have the most incredibly gifted faculty and staff, and your commitment to the success of our students and this institution was going to ensure the highest quality of education possible. You all didn't just meet that expectation, you far exceeded it. So from the bottom of my heart, thank you. Today, I'm joined by Dr. Karen Olmsted, SU's Provost and Senior Vice President of Academic Affairs, and we'll also hear from Dr. Janet Warmack, our Vice President of Administration and Finance, and Eli Maudlin, my Chief of Staff and SU's COVID-19 Response Coordinator. We'll all help you to ask and answer questions that you're sending to stayinformed@salisbury.edu. Now, to discuss some of our operations plans. Based on the availability of the vaccine and our consistently low positivity rates, thank you, we are looking to bring most employees back to work on campus by July 6th. This is a campus-wide target date, and faculty and staff will work with their departments and with their supervisors on the exact timing for their return. Human Resources will help provide more information and help to guide supervisors through this process. Of course, many employees have already been back to work on campus and will continue through the summer. During the summer, all students and employees will be required to test every 14 days in order to maintain access to campus. With that said, we are starting to receive vaccine data for those of you who are fully vaccinated and have completed the consent form on GullNet. Once we have reconciled this information, we will start moving fully vaccinated employees to the once-monthly testing group. Employees will receive an email when they've been moved to this once-monthly testing group with additional information and instructions. Those for whom we do not have vaccine information will also receive an email which will have links to the consent form, exemption policy and form, and a way to upload your vaccine data if we're unable to pick it up automatically. For example, if you live in Delaware or another area that's not served by CRISP, Maryland's state health information system. I know there have been a lot of questions about exemptions to the vaccine requirement, and Dr. Janet Warmack is here to address some of those questions right now. Dr. J, take it away.
Thank you, Dr. White. Faculty and staff should know that COVID-19 exemptions will be handled similar to the way we deal with existing requests for accommodations. When employees receive the email that Dr. White mentioned, they will have more information on what qualifies for an exemption and how to apply for one. Per the USM vaccine requirement, exemptions will be provided on medical and religious grounds. Those with approved exemptions will be required to test twice a week and will use a link provided by Campus Health to set that up. As employees return over the summer, some may only be partially vaccinated, and those employees may be in the 14-day test group until they're fully vaccinated, at which time they will move to the monthly testing group. Those who are not vaccinated and who have not applied for or received an exemption will also be required to test twice a week. Unvaccinated faculty and staff, whether they have an exemption or not, will be required to complete the daily symptom monitoring. We expect to transition those who are unvaccinated to the twice weekly testing group sometime in August. Again, these requirements are only for those who need access to the campus. I also want to thank faculty and staff for completing the survey sent by HR. There's still time to provide your feedback using the questionnaire, and I encourage you to do so. We want to hear about your experiences. I also want to mention the current status of telework. While we've set up a target return to campus date of July 6th, we recognize that some employees will return a bit later in the summer. Those arrangements need to be worked out with supervisors as all existing telework agreements expire at the end of June and new agreements will need to be approved. Human Resources is working on updated return to campus guides and telework agreements. And they will work with supervisors to guide that review process. As we examine the future of telework, we're focused on ensuring that we are working in ways that best support the mission of SU. We're also committed to ensuring equity through this process. Finally, I just want to echo the President's appreciation for the incredibly hard work that you've done during this pandemic. I'm relatively new to SU, but I've spent almost my entire career in higher education, and I can tell you that this university has some of the most dedicated and hardworking faculty and staff that I've ever had the pleasure to work with. Thank you, and here's to a successful summer and fall 2021. Dr. White.
Thank you, Dr. J. As we move into the summer, we will continue to provide information through email, social media, and departmental leadership. So please keep an eye out for communications and details on important updates. Over the last year, we've operated with a heavy mix of in-person and virtual learning, and our faculty did an incredible job maintaining high-quality instruction in a variety of formats. We've long had excellent online programs at SU, and we look forward to growing those opportunities, but we're also happy to return the vast majority of our courses to the physical classroom. Dr. Karen Olmsted is here to discuss course modalities and other operations for academic affairs. Dr. Olmsted, welcome to the town hall.
Thank you, Dr. White. As you said, we're thrilled to be planning for next academic year at relatively normal densities in 80 to 85% of our course sections. Our faculty have been absolutely amazing in their ability to innovate and continue to focus on students in the incredibly difficult 15 months we've had. But at its core, SU's mission is best served with in-person experiences, whether in the classroom, studio, laboratory, other instructional space, in the bulk of our sections. And so we're focusing on that. Although, as the president said, we do have a lot of quality instruction that remains online. We expect to return to full density in the fall with mask wearing in the classrooms and other indoor spaces, best on the best available science. In the fall, if a student is sick, we'll be following our pre-pandemic processes and accommodations, and we'll be getting information out about that. But in the fall or next academic year, if a student is not cleared for class because they chose not to comply with the testing or screening, the faculty are not required to provide opportunities for makeup work. For faculty, we plan to be at full densities in the classrooms, as has been mentioned, and really ramped back up by August 16th. We're confident in our ability to return because of how safe, as several people have mentioned, how safe our campus has been over the past year. And our students and faculty and staff have followed those safety precautions and have kept the rate of COVID well below local, national, or state averages. At the start of our semester, our plans call for everyone, including faculty, to be masked in classroom spaces. However, as we monitor the number of cases on campus and in our region, we may be in a position to relax that requirement. Again, operating the best available science. We're all truly excited to welcome back our returning students as well as our new students and hope to have a vibrant and safe campus this fall. And I want to echo Dr. White and Dr. Warmack's thanks for the incredible work the faculty and staff have done this year. Thank you.
Thanks, Dr. Olmsted. We'll now look to Eli Maudlin for the questions that are coming in. You can still send them in. Send them to stayinformed@salisbury.edu. Eli, what are people asking about today?
Thank you, Dr. White. The first question, if an employee is not going to get vaccinated, is not granted an exception or exemption, and cannot work 100% off campus, what will happen to that employee? Will they be able to get tested twice a week and remain employed?
Well, I want to be clear about this. Our top priority is to protect the public health, to keep everybody on campus safe, and do that while returning to more normal operations. So yes, an employee who is not vaccinated and does not have an exemption can test every Tuesday and every Thursday and every single day, do the screening for COVID symptoms. But if you miss your test, then you will not have access to campus. And if that means that you're unable to do an essential portion of your job, it means that you will be subject to a disciplinary process that can lead to termination of your job. So if you don't get an exemption, if you don't get vaccinated, you are putting yourself at risk and you are putting others at risk.
Thank you, Dr. White. Following up, I think this is a similar question. What recourse will SU employees have, faculty, staff, PIN, or contingent, if they do not receive a vaccination?
Well, as I mentioned before, the only recourse there to have access to campus is to screen daily and test every Tuesday and every Thursday without fail.
Speaking on exemptions, if an employee does receive an exemption, will they be permitted on campus or will they be expected to continue to work from home?
Exempted employees are welcome to work on campus, but they must test twice weekly in order to do so.
Assuming the SU community will not be 100% vaccinated, what are your plans to address how we gather on campus for various activities, such as group meetings, work meetings, other events and gatherings?
Well, as far as we're able to tell, given the current state of the pandemic, the requirement to test twice weekly and screen daily should be enough to keep everyone on campus safe. With that is our strategy for ensuring the safety of classrooms and meetings and other kinds of events on campus.
Will fully vaccinated faculty and staff still have to complete the daily screening?
Employees who are fully vaccinated and moved into the once monthly testing group will not have to screen for symptoms daily.
What about visitors?
Visitors will have to be screened to be on campus, yes.
Will coworkers in shared offices be treated as students in shared dorms? In other words, will they be able to go maskless as if they were living in a pod?
So masking policies are going to be fluid. So for now, we're going to require masks in most spaces, but eventually, as the progress of the pandemic improves and the frequency of the infections gets smaller and smaller, we are going to be able to relax many of the masking requirements. Whether that happens in your office probably depends on what kind of spacing is possible in your office and what kind of activities go on, whether your office is public facing or not. Stay tuned for a detailed answer to a question like that.
Thank you, Dr. White. Will there be any additional work from home opportunities following the employee return to campus?
Well, there will be some opportunities for people to work from home, depending on what their job situation is. That's something that they're going to have to work out with their supervisor and with HR. So everybody's job is at least a little bit different from everybody else's. And although we will have some opportunities to work from home, I anticipate that the vast majority of jobs at SU are going to require some presence on campus.
Dr. White, will additional dining or break room spaces be made available, particularly if we're not allowed to remove masks in office spaces while we eat and drink during break time?
Well, we're going to do everything that we can to make sure that people have a comfortable place where they can eat. But I think in many cases, dining outdoors at one of our picnic tables or outdoor tables is going to be your best bet.
Dr. White, if symptoms arise from something other than COVID, such as the common cold, would employees need to work from home during that time?
My goodness. If you're sick, stay home. Take advantage of the sick leave policies that we already have. That would be just part of the normal operation.
Does this mean that if the university so I'm going to rephrase this question a bit. Does the university have record of both of my vaccinations if I've signed the consent form?
The answer is probably if you live in Maryland or an area that's served by CRISP. So CRISP is a regional medical information sharing organization, and a lot of people who live in Maryland and Northern Virginia and DC their information should come through CRISP if you've signed the consent form, and we should know about your full vaccination status. Sometimes the information doesn't get reconciled properly, and there could be a problem like that. But if you live in Delaware, then you're probably not covered by CRISP. And so we have an alternative way for you to upload your vaccination data so that we can get it, and you should stay tuned. Look in your email for instructions like that.
Dr. White, this is a question about returning to campus, particularly for those returning prior to July 6th. Can supervisors ask or require employees to return to campus before July the 6th?
Yes. So we all have jobs to do here at SU, and sometimes those jobs change. And there are certainly times when it's appropriate for a supervisor to ask an employee to do their job on campus. So yes, of course, your supervisor can ask you to come into campus to work.
What precautions will be in place for the fall, like masks, social distancing, and the other safety precautions that we saw this last year?
So our plan for at least the beginning of fall is that masks will be required in many places, especially classrooms. Distancing will be evident in many meeting spaces, but classrooms themselves will be at full density. And so we'll probably have masks, but not significant distancing in classrooms. So there will be a mix of requirements depending on what the activity is and what the space is where that activity is taking place. Obviously, as the pandemic progresses and as the recovery from the pandemic progresses, masking requirements and distancing requirements will be relaxed. And so we are going to have those policies as a bit more fluid. So expect that sometime during the fall semester, if all goes well, we may be able to relax some of the masking and distancing requirements. But at the beginning, masks are going to be required at the beginning of fall semester in many, if not most places.
Dr. White, this question is about the timing of test scheduling. If I leave the state for vacation, can I return to the office before getting tested? I assume this person would have fallen out of compliance during that time.
Yeah, so if you are fully vaccinated and in the once monthly testing group and you go on vacation and come back before your month expires, you're good to go. You're just fine. If you fall out of compliance, if you miss a test as a result of being away from campus and you're no longer in compliance, then you will have to get tested before you can come back to work. So the testing center will only be open on Tuesdays and Thursdays. So if you're planning to be away for an extended period of time, plan to come back on a Tuesday, schedule your test for a Tuesday or a Thursday. And then once tested, it only requires about an hour in order to get you fully restored to campus access. So you should be okay. That is to say, if your test is negative. So plan to come back on a Tuesday or Thursday. Make your life easy.
Thanks, Dr. White. You should know that someone watching really likes your tie.
Thanks. I got this in Ireland a few years ago.
What happens if a staff member misses their test? Same question for a faculty member.
Yeah, same deal. If you miss your test, you are out of compliance and you don't have access to campus. But by getting tested on a Tuesday or a Thursday, you can almost immediately restore your campus access, and then you'll be fine.
For employees and students who do not receive the COVID vaccine, but do not have a religious or medical reason, are they still able to come to campus? A similar question to the one you've answered earlier.
Yes. If you do not receive a COVID vaccine and you don't have an exemption, you can still come to campus, but you must screen daily and you must get tested every Tuesday and every Thursday without fail. Because if you fall out of compliance and then come to campus anyway in violation of the restriction, then you will be subject to disciplinary processes that could lead to termination. This is really serious. And it's serious because we need to protect the public health on campus. We need to keep everybody safe while we are returning to more normal operations in the fall semester.
Dr. White, the next question is about visitors to athletics. Do we have a timeline on when we think non-SU faculty, staff, and students will be allowed at SU sporting events?
I don't have an exact date for that. I imagine that in the fall, we will be allowing limited visitors, but I don't have the details for that at this time. Sorry.
Dr. White, the next question is about the testing schedule. Will other options be available other than Tuesday and Thursday for COVID-19 testing in the summer or the fall?
So we have to have everybody come on a Tuesday or a Thursday because that's when we have the staffing available to handle the volume of testing. If you have an ADA accommodation or something like that, then we will be able to take care of you. But without an ADA accommodation, it's Tuesday or Thursday. That's it.
Dr. White, if someone that is fully vaccinated wants to test more than once a month, will they be able to do so?
We're going to discourage people from getting tested more than about once a month. There's some flexibility in the dates that you can choose to schedule your test, of course. But we're going to discourage people from testing, weekly or twice weekly, unless they need to.
Dr. White, I think this question is similar to the one that you received about testing on non-Tuesdays and Thursdays with exemptions. But if an employee must travel for their job on campus, and they are unavailable on a particular Tuesday or Thursday, is there going to be an option for that?
If you have an exemption from the vaccine requirement, that is to say for a valid medical or religious reason, then we will work with you to get tested on the day that you can come to campus. Otherwise, Tuesday or Thursday.
And Dr. White, if someone, whether it be a faculty, staff, or student, isn't vaccinated and has no exemption on file, and they need to come to campus periodically, what do they need to do?
That was for a person who's not a student.
This is if someone, faculty, staff, or student isn't vaccinated and has no exception on file and needs to come to campus infrequently, what do they need to do to gain access to campus?
You need to get tested. You need to come on a Tuesday or a Thursday and get tested so that you're back in compliance. If you have not been vaccinated, you'll have to get tested on a Tuesday and a Thursday. And once you're back in compliance with the testing requirement, then you will have access to campus. Otherwise, no.
Dr. White, is there a deadline for when employees will know their work modality moving forward for the summer and the fall?
There is not a strict deadline for this, but our target date, as I mentioned, is July 6th. So the current telework policy, as Dr. J said, it expires on June 30th. And our target date for getting everybody either back to campus on a revised telework agreement is July 6th. That is going to be subject to some conversation between you and your supervisor and HR. And so the timing for that might be, plus or minus a couple of weeks, something like that. But we're hoping to get everybody settled by about July 6th.
Dr. White, will campus health still be set up to support employees? And will employees be able to schedule tests if they believe they might have been exposed or are feeling symptoms?
Yes. So if you think you might be exposed or feeling symptoms, you should get help either from your family doctor or as rapidly as you possibly can. But campus health will still be around to help employees this summer and fall.
Another question about the migration from the existing testing schedule to the less frequent schedule. For employees, now and through the summer, they'll be testing every 2 weeks. When would they move to monthly testing if they're fully vaccinated?
Yeah, well, this is a little bit difficult for us to say because we are already getting some information from CRISP about employees who have given consent in GoalNet to get your information and are fully vaccinated. So some people will very shortly be sent an email informing them that they're moving to the once monthly testing group. And that email will contain instructions for how to do the scheduling and so forth. But we're not in control of all of the reconciliation process. Some of this has to happen at CRISP. And sometimes there are delays in reconciling the information. So we're going to get the information as much as we can from CRISP, but then we will be in touch with you if we don't have your information to see what the problem is, whether it's on CRISP's end or whether it's about consent in GoalNet. And for those who we do not have information, we will be setting up a separate process for you to upload your vaccination information so that we can get that, and then we'll move you to the once monthly testing group. So I wish I could give you a firm date, but it depends on the reconciliation process, and we're just not in control of all of that.
Thank you, Dr. White. That does it for all of the questions this afternoon.
Okay. Well, thank you, everybody, for joining us for the briefing. Thank you, Dr. J. Thank you, Dr. Olmsted, for being here. We really appreciate your participation in the briefing. Again, I want to just express my thanks to all of our faculty and staff who have worked so hard this past year to provide our students with a great education under just enormously difficult circumstances. Thank you for joining us today. If you have any more questions, send them to stayinformed@salisbury.edu, and we will try to get them answered for you. Thanks, everybody. Take care.